I'm calling the June meeting of the Maryland Health Benefits Exchange Board to order. The first item of business is approval of the minutes. Have you all seen the minutes, and does anyone have any comments?
I have a comment on page 5. The last paragraph that we were discussing the IDIQ and the staffing. And one of the things, and we can look at the recorded line, one of the things I mentioned was that the cost variance between the two approaches was somewhere between $5 to $10 million. And if that can be added in the minutes.
There being no objection, we will add that. Any other comments? Then I'll entertain a motion to approve the minutes.
So moved.
Singh, motion by Singh, second.
Ben Steffen seconds.
Ben Steffen seconds. All in favor, say aye.
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 Opposed? The ayes have it. There are no one signed up for the public comments, so we'll move on to the executive update.
Thank you, Vice Chair McCann. And this is our annual meeting, so I want to make that statement because once a year we do have an annual meeting, and this is it. We always hold that in June. And thank you, everyone, for your flexibility in moving to the Zoom platform. We've been able to be remote with our Google Meets for well over a year, but our members of the public can call in and dial in and listen in, but they can't see us. So as we will likely continue in a hybrid mode, no matter what we do, we like to always be as transparent as we can. We thought it was a good time to move to Zoom and start allowing the public to not only hear us, but to see us. So thank you for that. And we made this transition in line with the new and improved release of our Maryland Health Benefit Exchange website. So that's our stakeholder site. That's not the marketplace. That's the site where, of course, all of your profiles are located, with everything about the board is located, everything about the agency, our history, carriers, our committees, etc. And it came out just fabulous. So really appreciate Betsy Plunkett and her team for all the work they did, and everyone contributed to make the site very user friendly. And of course, we encourage you, if you see anything that doesn't look just right, let us know. We always think we've got everything, but as with any new release, we may have missed something. So please take a look at it. We're pretty proud of it. And it has a lot of excellent data on it. This year, we are also celebrating, or this month, we're also celebrating the 10th anniversary of the exchange. So we had a really great, fun live on Facebook celebration, and very, very grateful that Governor Hogan recorded a message for us, and Senator Sarbanes recorded a message for us, and Congressman Sarbanes, we also had a recording from Delegate Pena-Melnick. So it was really fun, and we had 3 of our navigators, connector entities on board that have been with us since the beginning. And it was just a really good way to showcase everything that the exchange has done since we were signed in as an agency 10 years ago. So thank you all for participating or stopping by. That it was a fun event. Another item we are celebrating is the recent decision of the Supreme Court decision. I think this may put to rest for a while that the ACA is here to stay, and that will be good in terms of the folks we serve, all of the Marylanders who don't have to worry about will their health care go away or not go away. And so they can have peace of mind that really the health care is here to stay through the Affordable Care Act. And we can, as our staff and our stakeholders, sigh a little bit of relief knowing that we can, move forward and look to the future and not have to worry about what might happen to us for at least the time being. So we're thrilled with that. On our new website, you will find the May data report, which has been updated. And just as a reminder to the public, those reports are updated monthly, generally by the 7th day of the next month. What's really exciting is to look year over year, and we have all the reports from years past. But year over year right now, our private commercial insurance enrollments are up 7%. So that's just super, and really a testament, one, to the need for health insurance, and two, to the cost of health insurance becoming more affordable. So we're thrilled about that. Medicaid enrollments are up 6% year over year. And that sounds significant, and it is significant. However, during the federal public health emergency, it's important to note that consumers have not been terminated from that coverage. So we expect that they'll stay under that proposal or that rule until the end of this year, at which point redeterminations will begin to occur. We'll likely see some of those folks moved over to qualified health plans, the private commercial plans. So more to come on that. The best piece of news looking year over year is that consumers that don't get any financial assistance, they can't get tax credits. They are, well, of course, this was before, now everyone is eligible, but those that don't have any financial assistance year over year were up 3%. So again, that does attest to the affordability of health plans. We'll continue to watch it as we move forward. All this good news, there's a little bit more with the end of the public health emergency in Maryland. And as we all know, Governor Hogan has ended that public health emergency. There's no more mask wearing, which is really good. But what that means for the exchange is that we will end our COVID SEP August 15th. That's been the planned date to end, and we will end it on August 15th. The tax SEP will end July 15th. That in a SEP special enrollment period that was extended through July 15th to be in line with the state extension for filing taxes. So that will end July 15th first date, August 15th second date. The other two things I want to make mention of, because this is our annual meeting, generally, if we have any changes to the procurement policy, we submit them at the July meeting. There are no changes this year, so you received a memo from Tony, our CFO, saying that included the policy, procurement policy, but that there are no changes in that. We have two open solicitations, one for Oracle Java SE subscription and one for Corticon maintenance renewal. So those are the only two that are posted right now, but anyone who's watching, let folks know that those are two active solicitations. And then just finally, as of July 6th, the leadership team will be on site at least one day a week. And after Labor Day, we'll start bringing our teams back in a hybrid model. And again, I'm just so very grateful to all of our staff that haven't missed a beat these last 15 months. We've done exceptional work and have really helped serve Marylanders in getting and keeping health insurance. So with that, Co-Chair McCann, or Vice Chair McCann, I will take any questions.
Any questions for Michelle?
Michelle, about 2 meetings ago, the chair had asked for a dashboard or benchmark report to be presented on some frequent basis. The data that we see on the website and of course the annual accomplishments report that we have received this time, both excellent. Are they in lieu of that, or will there still be another dashboard report coming for the board on monthly or quarterly basis, data elements?
Singh, let me go back and look at that, what the request was, because if it's something different, we can certainly prepare it. We do a lot of quarterly updates for the board, and we do the monthly data reporting. So I'll have to go back and refresh my memory on what was asked for to make certain that we're supplying what was, if there was something different that was asked for.
Sure, thank you.
Yeah,
Ed,
I was going to, add that the monthly data reports are quite exhaustive. Everyone should take a look at those. If you haven't, I think there's a lot of information presented. They're PDFs, not the parlance of an electronic report, but they are quite informative and raise for a lot of questions too.
other questions or comments? Michelle, thank you. Our next topic is our meeting schedule. You all have received the draft schedule. Michelle, you want to proceed?
Yes, absolutely. And the dates that we have scheduled, same as this year, January 18th, February 22nd. Those are on Tuesdays because a Monday's a holiday. April 18th, May 16th, June 20th, July 18th, September 19th, October 17th, and November 21st. No meetings in March, August, or December. And we will we put that schedule before the board to approve. That is your 2022 calendar year plan meeting dates, board meeting dates.
Are there any questions or comments?
I did
Dana.
have a question. Oh, sorry, go ahead.
Commissioner, yes, go ahead.
Dana. Okay. So I don't have any issue with the dates themselves, the times, et cetera. But what I was looking for, and maybe this will be separately scheduled, is sort of the date for a board retreat and planning session as we think about what will our focus be in 2022. So I don't know what the thoughts are about that. I think that's the type of session that really requires more than 2 hours. But it may be that you're looking for a different date for that.
So typically what we have done is we do that session the first Friday in January. So it would be January 7th of 2022. And so that's right before session starts, which has worked out to be a pretty good day for everyone. And that's a full day session. Of course, we can revisit that, but that would be the scheduled date for the board leadership retreat.
Michelle, maybe next time we can make that official, since it now strikes me as being somewhat tentative.
Yes, we can certainly do that. And we can, we'll send that data around and make sure that that works for everyone, but that's typically what we've done the last several years.
Dana,
I have a question. I see that we are scheduled for those dates to meet at Patterson Avenue. And I wondered if we're going to be meeting there anytime this year.
Very good question. And yes, we are tentatively looking to going back to in-person meetings for starting with the September meeting. And so that is the tentative plan.
any other questions? Then I'll entertain a motion to approve the meeting dates for 2022.
So moved.
Mary Jean, seconded? I'll second it. All in favor, say aye. Aye.
Aye.
Bye.
Opposed? The ayes have it. The next step, Dana, is the Standing Advisory Committee, the approval of new members.
Yes. I'm not sure if there's going to be the presentation was sent out. I don't know if they were going to be doing that, and if so, would that be Joanna, or do we just need to refer to our notes? Whatever. Let's go forward. Okay. A couple reminders to the board about the statutory requirement to create a standing advisory committee that is diverse in gender, race, ethnicity, and geography, and that includes a cross-section of stakeholders. Another reminder to the board is that, quote, SAC members shall be residents of the state of Maryland or affiliated with an organization or corporation with substantial contacts with the state. Okay, the Maryland Health Benefit Exchange accepted applications for SAC membership during April to May of this year. And the exchange received applications from 6 people, all of whom are shown in the presentation that was sent to you. And if appointed, this would join the current 19 SAC members. Be assured that MHBE staff track how SAC membership compares to Maryland's population in terms of gender, race, ethnicity, and geography, and works to encourage applicants who reflect Maryland's population and have relevant expertise. The applicants do indeed represent a diverse cross-section of stakeholders and would bring valuable perspectives to the SAC. The 2021 applicants include Jonathan McKinney, who is the Mid-Atlantic Regional Director for the NAACP, Dr. Ligia Peralta, CEO of Casa Ruben Incorporated, a nonprofit clinical and research initiative which addresses health disparities in Maryland. She's a pediatrician and researcher also with the Center for Biomedical Innovation at MIT. We also have Manzi Razwant. She's the Vice President of Policy at the Maryland Hospital Association. We also have Professor Dylan Roby, who's a Professor of Health Policy and Management at the University of Maryland, College Park. Alyssa Singara is an insurance broker who is active in the individual market. We also have Kathleen Wee, who's the CEO of United Healthcare Community Plan of Maryland, and she's United's Medicaid Managed Care Plan in Maryland, and she's the CEO for United's Individual Exchange product in Maryland. So Vice Chair McCann, there's a request now before the board to appoint the applicants I just reviewed. After any discussion about the candidates in the process, they would like to move to approve the appointment of those applicants. Thank you.
Mary Jean,
So it's my recollection that last year we ended up reappointing beyond their term people from the Eastern Shore because we were having a lot of problems finding people from the Eastern Shore. And I noticed the number of these people are from Howard County. Were we not able, we did get one from the Eastern Shore. And this is the first of my questions. Were we not able to get, are we continuing with the people we sort of extended beyond their terms last year, or what are we doing with Eastern Shore representation?
That's a good question, and I referred it to Johanna. If you could tell her what the staff has been doing.
Yes, happy to do that. Can you hear me?
yes.
Okay, and sorry, my video is not working. But yes, you're right. We had 2 candidates whose terms were extended, or 2 members whose terms were extended last year, both brokers from the Eastern Shore. So their terms do end at the end of this year. And we recruited Alyssa Sinagra, who's a broker on the Eastern Shore, to kind of step into that representation of the Eastern Shore. But you're correct in that that's only one of the applicants this year.
And Tony, my second question is, and Kathleen Wee, since she's United Healthcare and United is a provider, is that in any way, shape, or form a conflict on the committee?
And
Go ahead, Johanna. I was going to refer this to you.
thank you. Yes, happy to address that. So we actually do have representatives from each of our other carriers on the Standing Advisory Committee, and the list of stakeholders that are to be included does include health plans in the statute.
Any other comments?
I don't have comments. I think it's quite a distinguished group of people that would certainly, be terrific to have on the committee. But my question was really a bit of a follow-up to Mary Jean's in learning a little bit more about what the active recruitment efforts are and how the process goes. This is the first time through for me. So I'm intrigued by, how do we advertise? How many applications did we get? What was the process for selecting these individuals? Just curious.
And we do have a slide deck. I think, Johanna, some of that's covered there. And Cynthia, I'm trying to share my screen, but it says host disabled participant screen share. But I think, was that in the slide deck of the process that we could refer
Yes,
to
it was.
as well?
Yes, so we do post the application on our website. I believe that's in the deck. I think it was April through May that it was up. And we share that with our existing standing advisory committee members to ask them to encourage applicants. I believe we also share that on social media. And then in addition, we reach out to individuals who we think might be interested or who are referred to us by other stakeholders as potential applicants.
Yeah, so I didn't think that I had seen anything in the slide deck about the process. It does a really good job of laying out, the committee and then the final selections. But just out of curiosity, did you have a larger group and then you selected these 6 from that larger group? And what is just the process involved in doing that?
Great question. And actually, you're right. I think we were thinking back to a previous version of the slide deck, which we then pared down. So we only had these 6 applicants, all of whom we're recommending for appointment.
Sure. And was this one of those years where you had to go out and affirmatively look for folks, or were these folks that self-selected?
We did, well, a couple of them were kind of recommended to us, and the rest we kind of affirmatively went out to seek folks that had particular expertise.
All right, thank you.
Are there any other questions or comments?
This is Secretary Padilla. If I may ask, do we have representation of any of the individuals that we serve in the advisory committee?
Thank you. That's a great question. We do not have any consumers that we serve. We have individuals that represent consumer advocates and consumer organizations such as navigators and other advocacy organizations, but not directly consumers.
Is that something that we would like to have, or?
Yes, I think that could be that would be a valuable perspective to incorporate in the future.
We have one of our members is with a federally qualified health center, and then we have one of our connector entities, and that's the closest we have with representing our actual insured members. But absolutely, when we recruit, we post it, and we can do some more targeted recruitment for that as well.
Thank you, Michelle and Joanna.
Michelle, I would just note that the version of the slide deck that you're showing does have the one person missing. I think you guys updated it just to make sure everybody sees Ms. Peralta has also been added. She's the 6th person.
Yes, that's correct. Thank you.
Hopefully you all had a chance to look at the resumes for all the people, including Dr. Peralta.
Other questions or comments?
I would just like to encourage the next time there is a recruitment period going on. I know I shared on LinkedIn that the SAC is looking for people. This was before I was the board liaison. So I would encourage our board members, when the Maryland Health Connection or the Maryland Health Benefit Exchange posts it, that you share that with your broad network.
Thank you. Just so we're sure, Dana, would you please repeat the names of the now, I think it's 6 people that we're appointing and then make your motion.
Yes. Jonathan McKinney, Dr. Ligia Peralta, Manzi Roswant, Professor Dylan Roby, Alyssa Sinagra, and Kathleen Wee.
And as she said previously, Dana has made a motion for the board to approve the aforementioned names. Do I have a second?
Second,
Second from Mary Jean. Any further discussion? There being none, all in favor say aye.
Aye.
Opposed? Secretary Schrader has joined us. Ms. Secretary, good to see you. Anything you want to say to us?
No, just keep doing a good job, Tony. Thank God you're, I've got you as a backup. It's been crazy. Thank you.
Please congratulate your folks and frankly, Commissioner, your folks on the good work they've been doing during this very difficult period. And Commissioner, Secretary Padilla also. Thank you all very much, and thank you all the staffs of each of your organizations. With that, Singh, it's your turn to talk about the Finance Committee. Never remember
Thank you.
whether we're a
Thank
committee
you.
or subcommittee.
I will have a very brief report. The quarterly Finance Audit and Compliance Committee met virtually on June 11th. We were glad to welcome Mary Jean Hearn on our meeting. This was her first meeting with us, and I must say, she was a very active participant. Thank you, Mary Jean, for your input. This was also a very lively and passionate meeting. And discussions are still in progress. And the issue we discussed was IDIQ, staffing versus employment, blended model, and more discussion to come in the future. We also reviewed the financial reports through April. Tony presented, Tony A. And I must say that we were under budget in almost all of the categories. Good job. Thank you very much. And we also had a compliance report, fiscal 21 through May 21. Kat presented those reports, Catalina, and she had a good breakdown of the reports in 4 categories. Fiscal 20, where we accept the risks of the findings. Fiscal 21 review, where we can mitigate, and we cleared those findings. And then there are some which are repeat fiscal 21, and there were new observations. They were presented, and Kat is going to present them at one of the future board meetings as well. So it was a good meeting. Thank you, team. Thank you, management, for presenting the information. And I'm also waiting for the day when I will be driving to the meetings over there soon.
Me too.
Thank you very much.
Thank you, Mr. Chairman. Are there questions for the chairman? Ben? Okay, again, thank you very much. We now turn to the quarterly IT update. Ben, Kat?
Thank you, Mr. McCann. Good afternoon, everybody. Good afternoon, Mr. Chairman, Vice Chair, members of the board, and everybody. I hope all of you can see the presentation as well as can hear me.
Yes.
Thank you so much. So today we would look back a little bit about our IT roadmap for the calendar year 2021, and then what we have so far achieved in the last 2 quarters, and then what is coming at us in the next quarter at a very high level. Before getting into the updates, I'd like to state to the board that IT's continued focus is to respond to COVID-19 pandemic related system changes, and hopefully in the near future, reverting those system changes to face the new normal. So that's our highest priority. And in the last quarter and this quarter and the upcoming quarter, we continue to tweak our technologies. And I will very briefly talk about one of those items in the upcoming slides that would our improve our operational excellence. One such technology is the robotic process automation that we continue to expand into our operations. And the third is obviously to engage with our consumers. As Michelle pointed out, our stakeholder site revamp, as well as building a live agent chat to integrate with our bot solution to serve as a channel for our consumers. And the last but not the least, obviously, is continue to implement all these policies, changes, system changes, as we agreed with CMS, also our Medicaid partners. So with that brief introduction, let me just quickly jump into the roadmap. This is it looks a lot of things, but it's probably familiar to you by now. This is exactly the same slide I presented in the last quarter with a few changes. I will address those few changes. And before that, I would like to state that we are on track. All the items that we had planned for each of these releases and each of these streams, like special projects or enhancements or MNO releases or Salesforce, everything have been completed on schedule. And the two items highlighted in red, I'd like to very briefly talk about it. And the one is the Department of Labor real-time wages check. This is an initiative to get the latest available wage information of our consumers to facilitate eligibility determination. And obviously, as you may be aware of, the Department of Labor is continue to face their system issues with respect to the Beacon 2.0 system. And we continue to engage with the Labor Department to seek some time to work with us to work on this initiative. And we have completed exchange side of the coding and internal testing. However, we are working with the Labor Department to complete other side of the transaction. And thanks to Andy and Kat and Heather and Sharon for facilitating the MOU. And last week we got the MOU agreed. And obviously getting agreed for MOU and doing the actual work are two different things. But we do have continuous engagement with the Department of Labor to push this initiative. And the second one is the IDB replacement. This is IDB means the interim database. Unfortunately, this has been interim for the last 10 years. So at a high level, what it means is when the exchange has a transaction, let's say a Medicaid transaction, and we send it to the Department of Human Services and the legacy CARE system, now the E&E system, would make certain changes to the transaction before routing it to MDS, MMIS system. This flow at that time when the system was built was a required interface. However, in the last 10 years, we have matured, all these organizations have matured in such a way that this interface, we think that is not necessary. And however, the exchange will continue to share the data as Department of Human Services requires. So our original plan was to do it in this quarter. Unfortunately, we could not do, but we also have another project that we are working with the Department of Human Services and Department of Health. We will be working in the near future. This is to integrate our MAGI Medicaid eligibility system with the non-MAGI system that Department of Human Services has to streamline certain transactions for consumers so that consumers can come to one system, and if they are not eligible, they would be automatically routed to the other system rather than having to enter the same information on both the systems. That's a large initiative. I will come back to the board in the coming months to seek approval. And once CMS approves the funding for that initiative, I'll come back to the board for providing more details. So we find this IDP replacement fits very well with that project. So that's going to be part of that project. So we move that potentially early next year within the deadline that we have that for the non-MAGI integration. So that's about these two items. And there are a couple of projects highlighted in purple, the American Rescue Plan Act and the Young Adult Subsidy. Those were not finalized at the time when I presented to the board in the last quarter. However, we are working on them. And in fact, American Rescue Plan Act, as the board knows, we already implemented. And the Young Adult Subsidy subsidy initiative is on track for July, August timeframe. This is just a quick wrap up. And going on to the next slide, this is the same slide I presented to the board, just to give a quick detail. And all the items that we have checked have been completed, except for one item, which is scheduled for March, and that's notice redesign initiative. As the board is aware of, our notices are unfortunately terrible in terms of the number of pages. If I get any notice from any government agency that has 14 pages, I'm probably not even going to look at it. So thanks to Andy and a lot of folks' efforts to get that reduced. So our goal is to reduce from 14 pages to 4 pages in most cases. So thanks to our legal team and policy team for weighing in. And we also reached out to Department of Health and got a lot of feedback and sign off. It took some time to agree on the design and the mandatory elements to be on those notices. So we are currently scheduled for July or August this year. And moving on to the next quarter, this quarter, for April, May, and June. As I noted, the ARP and HP.com revamp. Besides those initiatives, last weekend we have implemented all the items that is shown under June. And I just wanted to very briefly talk about one item that's highlighted that says 20 stakeholders reports to ClickSense dashboards. This is a legacy way of our way of doing. We have been doing this for years. Exchange used to send almost 75 reports every month to various stakeholders, predominantly to Department of Health, partly to facilitate the transaction itself for the consumers. And thankfully, our systems have improved a lot in the last 10 years, obviously. And that calls for a change in our approach to these sending these reports to the health department. Thanks to the MDH staff who are working very closely with us. And we are converting a lot of these reports into dashboards where the workers can click through, dig through, and identify information what they need. So I will provide more update as we move along with this project. It's a continuous effort. We will still have some reports that we may have to send to the Department of Health, but our direction is to adopt more technology, latest technology, and rather than pushing the data, they should be able to pull the data at any time they need. And moving on to the next quarter, which is July, August, and September quarter, I would like to stay very briefly on a couple of items. And in July, we have this automatic income document verification. So what we're currently doing is when a consumer comes to the exchange seeking Medicaid, let's say, and the exchange systems reach out to the Department of Labor system data and see if the consumer's income is in line with, or pretty close to be in line with, what Labor Department says through their wages system. And if not, then we go to the federal hub to see if IRS data is pretty much in line with what the consumer says. Unfortunately, the data across these systems are not even remotely current. What I mean by that is the Department of Labor gives data which is generally 2 quarters old, and the IRS data is generally 1 year old. So what it does to the consumer is we tend to ask the consumer to provide a proof. And earlier, when the consumers were in this situation and they have to print their, let's say, the pay stub, latest pay stub, and then scan it and mail it, and then the worker will upload it, verify it, upload it, and clear the eligibility flow. That took a long time, obviously, as you can imagine, it may take several weeks. And over the years, when we implemented mobile app, we gave the opportunity for consumer to take a snapshot of the pay stub, for instance, and upload it right there. That avoided a lot of time in terms of mailing and uploading, etc. So that really reduced a lot of time. But again, that is again a legacy way of doing in some ways. So what we are doing is when what we are attempting to do here is when a consumer uploads an income document, we will have our AI-powered bot that can scan through the document and identify the type of document. It could be a pay stub, it could be a social security benefit statement, or a few other documents, or an affidavit, and extract the pay information, and then run it against the rules, and then verify right there. This dramatically would reduce at least 5 to 7 days of time between consumer uploaded the document and worker verified the document. Again, it's a technically complex project, but thanks to the Medicaid team for supporting us in this initiative. We do understand completely that it's not an easy step to accept a bot verifying document. So we are taking it one step at a time. In this July release, we are providing some sort of a soft verification. So meaning when the system verifies it, system is going to say system verified, still requiring the worker to come and verify it. Our goal is to implement this way and go through for a few months, maybe 1 quarter or 2 quarters, depending on the comfort level of the Medicaid team, and then provide the data to show, hey, 90%, 95% of what workers approved are basically what did. So if we could get that kind of a data and then sign off from Medicaid, we could really automate at least 40% of such documents. We are talking about hundreds and thousands of documents. And eventually, our goal is to take it to real time. When a consumer uploads the document, right there, we should be able to identify the document and validate the document, and either provide eligibility or request the consumer to take on the next step. So that will be a really good effort for the consumers. Thanks to everyone for working on this effort. The next item is the real-time QSP enrollment.
Venkat, could I ask a question there?
Absolutely, yeah.
Our good friends in the Department of Legislative Service audit and our good friends at the IG's office, among others, do we have any way to make sure that they then don't come in and say, well, your 7% error rate and it's costing the government X and so forth and so on? You know where I'm going.
Yeah, that's a great question, Mr. McCann. On the flip side, actually, again, we would like to give a 99% or even 100% accuracy if possible as a starting point, and put in checks and balances mechanism. Anytime when the bot, what we call as a confidence score, we can tweak that, and if it is not falling within the comfort level of our Medicaid threshold, then we can route it to the workers. On the flip side, what we are beginning to see, again, we are working with Medicaid team, we are seeing the bot is saying the document should be rejected, but the workers have approved them. And maybe they have valid reason for doing so, but that would really help the audit folks to catch those instances and potentially avoid fraud, waste, and abuse type of situation. So we are working on both sides, but that's a great point.
Thank you.
Thank you. On the real-time QHP enrollment, thanks to CareFirst for working with us on this. Thanks to Johanna and team for supporting us. So what we are doing is when the consumer comes to purchase the private plan and make a binder payment, we are already given the option to Kaiser and United Health to pay online directly from our site, routed to payment site. With CareFirst, what we are doing is trying to put one other additional step. When a consumer comes, selects a plan, makes the payment, right there, CareFirst would be sending an enrollment transaction to us. It's pretty close to real time. Our expectation is within 15 minutes. And that completes the transaction right away, as opposed to the carriers waiting for one full day to receive the transaction from the exchange and finding out if there are any issues. That would, hopefully, we are hoping to reduce at least one more day for the consumer in terms of wait time. And once we are successful with this initiative, and our hope is to take it to the other carriers as well. And these are two key projects in this July and August, obviously the Young Adult Subsidy and the last phase of our worker portal revamp, which is basically we are giving a 360-degree view of consumers' information data to the workers. Currently, the workers are going through various screens to piece together information about a consumer when they are working on a case about a consumer. So this would really, we hope to improve the efficiency of the worker and case workers, as well as our call center team. thanks to Heather and team and Debbie Rupert at Medicaid for helping support us in this as well. And September is a very busy period, and we continue to schedule the real-time interface with the Department of Labor, and we will see how that goes based on the time availability from the department. And we also, as you know, that's the time for our annual plan management changes and UHP renewal and OE related activities as well. So next quarter, starting July, is pretty packed for us. So that's pretty much about an update, and I'm open for any questions.
Any questions for Venkat? I don't see any. You're going to move on to Corticon?
Thank you, Mr. McCann. Yes, appreciate it very much. And hopefully I can. Okay. Sorry about this brief interruption. Thank you so much for waiting. And Corticon is our exchange business rules engine, and we have been using it for years. And we do continue to evaluate Corticon versus other products in the market. However, our Corticon is very tightly integrated with the exchange systems, and also the cost of renewal as opposed to jumping into a new procurement of a new rules engine is significantly lower. As we understood, the new implementing totally a new rules engine for exchange for whatever reasons would cost in millions actually. So, but we do see that Corticon is a great software for us. All of our Medicaid, QHP, dental, and presenter eligibility and other rules are stored in this system. And we continue to clean up the system. What we got from legacy system is what we got, but we continue to clean up and organize and ensure that more modular code is built in, and our core Java code is separate from this. That is one of the requirements of our CMS modularity. So with that, I will stop there and request Raylene, our procurement officer, to talk about the procurement.
Could I ask a question just a moment?
Sure.
I wasn't clear. Does Corticon date back to the original activities that resurrected the exchange after it fell apart?
I'm not sure, Mr. McCann, about the original exchange, which we based on the IBM systems. I'm not sure about definitely.
But this was part of the fix. So this
Exactly.
is sort of the last remnant of the emergency actions that were taken care of in that 18 months after the system collapsed.
Yes, Mr. McCann. This came with as part of our Connecticut solution that the vendor integrated Deloitte brought to us at the time.
If you had complete, if this is an unfair question or an improper question, Raylene will tell me. But if you had to go back to the old line, if you had a clean slate, would you use Corticon?
I'm sorry, Mr. McCann, is you asked me?
Yes, yeah.
Yeah, absolutely. And Corticon is two reasons it's really good. One is the ease of use in terms of repeating the rules versus the code, and the modularity function it has. In fact, we are looking at there is the next version of Corticon, two different versions. One is currently we are using Corticon 5.7.2, and there is a 6.0 version which provides a lot more capabilities. Again, that comes with our renewal. And also there is a totally new way of coding that's called Corticon.js using the JavaScript as the front end. So that is the next level of technology. So maybe in 2 years, we may want to visit that within the Corticon ecosystem to see if that's really useful. And one point I would like to make is MD Think is currently using exactly the same software and same version at this time. So we will be aligning with MD Think as well based on how the technology evolves over time.
Thank you. Raylene, the floor is yours.
Good afternoon, everyone. And so we are renewing the license for a 2-year period rather than a 1-year period, which is what we did in previous years. The licensing model is basically for the maintenance and support renewal. The method of procurement being used is the invitation for bid, The current, I think, cost of QuarterCon licenses for a single year was at $327, $226, and 60 cents. The anticipated cost of the licenses renewals for the next 2 years currently stand at $683,678 and 32 cents. QuarterCon has been advertised. It will close July 8th, and we will be back at the July meeting for approval of that award.
Thank you, Raylene. Is there any questions?
Just one last one. Is this one of those things where we're buying the software, but the invitation to bid is from different companies that would provide the software, like some of the other systems we use?
Correct.
Thank you.
You're welcome.
Any other questions, please?
Thank you,
No
Mr. Chairman,
questions?
Mr. McCann, and the
Yep.
board.
No questions.
Thank you.
Andy Rander, you're up.
Thank you, Vice Chairman McCann, and let me share my screen now. All right, so since this is the annual meeting, we usually do a year in review of the accomplishments and the challenges of the past year. So let's get to it. We had a record open enrollment, 166,038 enrolled. That was a 4.5% increase, the highest in the 8 years of Maryland Health Connection. And I think these 2 points are also important to make. Of our peer state exchanges, the average growth last year, according to acasignups.net, was 1.4%. So that's 4.5% for us, 1.4% for the state exchanges on average. And for the state exchanges in states that had expanded Medicaid, which is most of those state exchange states and some of the federal marketplace states, the growth was 0.7% for 2021. So again, 4.5% looks even better in comparison to those other numbers. Number 2 is our response to COVID-19. More than 175,000 Marylanders have used the COVID special enrollment since we launched it in March of 2020 in concert with the governor's emergency declaration to enroll in private plans and in Medicaid. Number 3 was our charge to hold down prices. Average rates dropped the 3rd year in a row. They've been down 31.4% since 2018. And also, we noted their rate drop in 2021 was the 2nd largest in the country in 2021. Maryland's 11.9% rate drop was second only to Maine, I think, which had a 13.1% rate drop. And in terms of dollars saved by consumers in Maine, the average consumer saved $83 a month. In Maryland, it was $60 a month on average. And again, that was 2nd best in the country. 4th, tackle inequities. We should point out that 1/3 of the COVID enrollees, the special enrollment, self-identified as Black, and we have done greater targeted marketing to minority groups and plan to improve that in the coming year. And last but not least, making it easier. More than 2,000 people have enrolled so far in the 2nd year of the Easy Enrollment Program in concert with the Comptroller's Office. There's still about nearly a month left for state tax returns, so we expect that number to rise. And we also were really the first in the nation to roll out all aspects of the American Rescue Plan, thanks to Venkat and Heather and Johanna and Betsy and many, to get all aspects of that. I think it was 3 weeks after President Biden signed that legislation. So that was all for the good. Connecting in a virtual year, we had 25,000 Navigator encounters with consumers during open enrollment, which of course precluded any face-to-face meetings. And the call center met all service levels in 11 of 12 months, the past 12 months. We have more producers, 200 plus new brokers were onboarded. We have 150 more brokers than we did a year ago. Being responsive to appeals, IT had built a new portal, escalated cases are at an all-time low, and most complaints have been handled in 1 to 2 days. Application counselors, more application counselors, 89, more than 89 new application counselors and 4 new organizations, 54 more application counselors than we had 1 year ago today. And to the rescue, as we mentioned, the American Rescue Plan, our training team created materials for training more than 400 consumer assisters in 3 weeks. So that was very, very fast, very speedy. And I also want to point out in terms of compliance, Kat had related that we successfully completed an entirely remote OLA triennial audit, an independent external financial programmatic audit with no findings, and a remote IRS 1075 safeguards triannual audit. The auditor, Kat noted, had said we were the first agency he'd seen without any findings in the first 7 of 8 sections. And compliance and IT also worked on a compliance tracker via Salesforce that we launched this year. We made the marketplace more accessible, we think. We launched, and some of this you've heard of during the year, but not maybe compiled in one place. We launched a more mobile-friendly application. And of course, more and more people are doing more and more on their phones. Thanks to the board's approval for investment in marketing this spring, where we typically wouldn't buy media time, we marketed the American Rescue Plan this session and have had a lot of response to that. And as Michelle mentioned earlier, we just launched a better agency website that we think is a lot easier to find stuff, compliant, and we're very pleased with the organization of that. So thank you to Betsy and Alexa and the marketing team and everybody who pitched in on that. I won't go over all the governor's comments, but he said an awful lot of nice things throughout the year about the responsiveness of Maryland Health Benefit Exchange in trying to meet the challenge of COVID. And we took seriously what has happened across the state and the many people who lost coverage, particularly if they lost jobs. And this is a little bit about our analysis on that impact. Now, this analysis was done last fall, so numbers I'm sure have shifted since then. But we had predicted that about 100, or estimated that about 142,000 people had lost employer-sponsored coverage in Maryland. About a third of them, 45,000, had gained coverage through a spouse's plan. And probably about, this was again last fall, so we thought at least nearly 18,000 had gained coverage through Maryland Health Connection, and we think that number is even higher now. And you can see from that map, the most severity of the job loss was felt in some of the DC suburbs, the Eastern Shore, especially the Lower Shore. But all said and done, probably about 63,000 became uninsured during the pandemic, and about 2/3, about 41,000, are eligible for coverage through Maryland Health Connection. So we continue to do everything we can to reach those people and get the word out to try to help them and let them know, in many cases, financial assistance is available. And I think Michelle had touched on this a little bit earlier, but comparing this past May to the previous May, the year-over-year increase, as you could see in Medicaid, about nearly 70,000 people more getting Medicaid coverage through Maryland Health Connection. In private plans, about 10,000 more. And in people in private plans without financial help, over 6,000 more. And that increase, I think, actually year over year is 24%. So I think we were very cognizant of and sensitive to complaints by people several years ago who were beyond the 400% of the federal poverty level, that this hasn't helped them. If anything, some of them felt in a worse state than they were before the Affordable Care Act. Chances are they said that if they were healthy and didn't have to, and weren't blocked out of getting coverage. But in any event, a lot that has been done through the reinsurance and other programs has helped lower their cost. And you can see it by the growth in the population of people who don't get financial help and yet are signing up through the marketplace for their coverage. And this is, let's see. There we go. Some recognition. Maryland Health Benefit Exchange and Vencat received the CIO 100 Award for the third straight year from IDG Communications in recognition of technological innovation to deliver business value to consumers. And Michelle was named one of the Healthcare Power 30 leaders by the Daily Record in April. I think an honor that Commissioner Bahrain also shared. And the next three slides, I'll just go over very quickly. These are every month at our all staff meeting. We recognize one or a few staff members with a coffee cup and a certificate for recognition from the leadership, but also their peers for maybe a project they were involved in to propel the agency in sort of our core pillar areas, whether it's communications internally or externally, whether it's technological innovation, consumer assistance, accountability. And I think we love these slides, these picture of these folks who had won these in-staff awards. I think it presents a very sort of compelling, appealing picture of a very diverse, vibrant agency where people come to work and are invested in the mission and as I said, of this group here, coming up with ideas to try to move it forward. So that was just a picture to present to the board. I thought that you all would enjoy it. And if you have any questions.
Any questions?
I don't have any questions, but it was an excellent presentation. One of the things that I also want to mention to you guys, and I just want to underscore how incredibly valuable and important that special enrollment period has been in so many different ways. Certainly all the ways that you've discussed and all the ways that you've addressed. But the other piece of that picture is that in June of last year, we became aware of people who were about to be terminated from their individual health insurance policies, because while the carriers had been holding them for several months, they had built up, so many months of non-payment that they were going to lapse. And what we were able to do because of the special enrollment was such a win-win for everybody. So we did slow the process down. We did ask the carriers to provide an extra layer of review and timing about when they could lapse for non-payment of premium, and to provide special notices around the existence of the SEP and how to get in touch with the exchange. But what it allowed me to do is exercise those emergency powers in a way that was not harmful to the carrier community, because they didn't have to carry people without premium, but also at the same time was enormously beneficial for those individuals who were already struggling to pay their premium, because they were able to get on the exchange and folks were able to take advantage of subsidies that they would not otherwise have gotten. So that's a whole additional subset of individuals who were so benefited by the special enrollment period. And I really don't want that to be missed, because those are people who really would just have been lapsed and really would not necessarily have had any idea what to do. So that's a whole other area of thanks for the fact that you guys were able to do that and maintain that for such a long period of time. Helped a lot of people through that.
And thank you, Commissioner. I was remiss in not thanking you for your support along that way, and also for the carriers who didn't blink when it came time to respond. And And as we showed with the statements from the governor, when he'd make a statement, it would go all over the place. And so there were a lot of people who recognized what was available to them, which, as you know, is always a tough message to get out.
I would make one additional accomplishment that we don't fully, I think, come to realize. And this goes all the way from the governor and the secretary and his predecessors and Michelle and his staff. We've just been through 4 years of an administration that, to say the least, was not friendly to the Affordable Care Act, was somewhat inconsistent and volatile and extraordinarily partisan. So it would have been very easy sometime over that 4 years to say something or do something that would have created an animosity, particularly within CMS, that could have thrown roadblocks in our way from all the way up and down. And yet we've been able to maintain a relationship, and God, I don't know how, that allowed us to, for example, the reinsurance, but many of the other initiatives that we've done over the 4 years. And it seems to me that there's a vote of thanks, as I say, all the way from the governor down to the secretary and Michelle and her staff for a lot of hard work, because I suspect at every level, from the lowest level that's just calling over to CMS to get some piece of information or to get something, all the way through others that are doing things all the way up to the secretary and the governor, have managed to keep that communications line clean and favorable. So it seems to me that they all deserve a great deal of thanks for us, because we wouldn't be where we are if we got into, shall I say, one of those kinds of contests with the CMS and the administration. So I say thank you all.
And Vice Chair McCann, if I can, or Co-Chair McCann, if I can just add to that, in addition, the governance and guidance of the Board of Trustees. So we appreciate you showing up at all the meetings, giving us your input, and we couldn't do it without your governance and guidance.
With all of that backslapping, we are approaching the end of the meeting. Now, I want you all to understand, the Secretary, you have any comments? I don't want to.
No, I just wanted to add one thought, and I've said this many, many times. The thing that I really like about the exchange, it's a very high quality public utility. Every time you flip the switch, it works.
Yeah.
And that to me is the test of performance. So.
Now, we're finishing an hour early this time, so next time we'll go to 5 o'clock. Okay? Look, there being no further business, and the silliness has got to come to an end. Thank
Tony?
you all. Yes,
Sorry for interrupting,
that's
but
okay.
I wanted to end on a high note with showing a really short video that the governor sent us to celebrate our anniversary.
Oh, okay, please.
Betsy, we're not hearing that too well.
Oh, shoot. Okay, we haven't showed videos before. We're still getting used to Zoom, so I don't want to keep you all, but I can't share it. It's too big, but be prepared to show you next time with the sound.
That's a good deal. That's a good deal. So moving right along. All right. Anything else for the good of the order? I will see you all in July. Again, thank you all very much.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Bye-bye.